Hello, everyone, and welcome to Inside Podcast. Here on Inside Podcast, we strive to inspire everyone to choose the food that brings the good, as well as to dive into the nutrition and dietetics community to know more about it. I'm Li Ling, the host for today's episode. In this episode of the podcast, we are glad to have a guest who is a clinical dietitian and a lecturer at the same time. As a clinical dietitian, her area of expertise includes obesity and diabetes. In academia, she is a fun lecturer that many of my seniors love. She is also an advocate of patient-centered care. Here we have our interesting guest of today, Dr. Ching Li. Hello, Dr. Li.
Hi, Li.
Dr. Li, how did you begin your journey as a dietitian? And is there any story or thing that sparks your interest to choose this path?
How did I begin my journey as a dietitian? I suppose, like all of you, after I finished my Form 6, some of you would have finished your, say, A levels. You have to think about what degree you want to get from your university. At that time, I did not think I wanted to be a dietitian. In fact, I didn't know what a dietitian was, right? But I knew that one, I was interested in food. Two, I was quite good at the sciences bit line, study a bit, you get A for biology, that kind of thing. So I knew that I might want to do something science-based, perhaps, something in healthcare, perhaps, because I quite like interacting with people and something to do with food. So then when you scroll through your programs in the university, there's a program called dietetics, and that's about food. You have to know about food and teach people about food. So I applied for that position or for that program at the local university, and then I got into. And then even in my first year, I wasn't so sure. First year, second year, still very blur. I studied alongside nutritionists or nutritionists to be future nutritionists. So we studied together, much like you at IMU. And there were times when I also didn't know what does a nutritionist do, what does a dietitian do, just study, just do. And it was only in my final year that I started to get a feel of what I might like to do. So the same for you guys, when you study your first you study your basic theoretical knowledge, right? Or your basic modules for those in the early semesters. Then as you move up the semesters, it starts to be a little bit more profession-based. And by the final year, you start to have a feel already. Do I want to be a dietitian working in the clinical area? Do I want to be a dietitian working in a community area? Do I want to be a dietitian working in a food service area? Do I want to be a nutritionist actually working in a community area? And when I graduated, I knew for sure I didn't want to work in food service. That one I knew. Okay, so I crossed it off my list. And actually, I was very interested in what nutritionists do, because I realized that, if you get right proper nutrition out there for the masses, right, for the public, you save a lot of lives, preventive and things like that. So then that's where my career started, in the outpatient community area.
That's a very inspiring beginning to hear. I'm sure that it's not easy to handle a few roles at the same time, which is to be part of an academic and clinical dietitian, as your hands will always be full. What made you choose to go for a blending of both instead of just focusing on one?
So what I'm doing right now at IMU, you're right, is the many roles I play. So we list down the roles I play first. I play a role as a lecturer. So as a lecturer, what do? I teach. Okay, I teach or help students learn. Okay, that's one role. Then I need to do a little bit of research as well. So I play a role as a researcher. And then I also play the role of a clinical dietitian. So I see patients at the IMU Healthcare Clinic. Once in a while when I go down, I might see patients at the IMU Seremban Outpatient Clinic. So you would say there are three distinct roles there. And why so many roles? That would be, if you go into academia, right? In most places, that would be what is expected. But it's important for me because I realized that all these three roles actually help me be a better dietitian in all three areas. So for example, when I see patients, right, I maintain my clinical expertise, because if you don't practice, you become rusty, like those of you who play piano, right, or those of you who go to the gym, if you don't work out, you don't practice, you become rusty. So you need to continuously see patients to maintain your clinical skills. So that does that. But when I see my patients, then sometimes I encounter situations where maybe the textbook has no answer, right? So where do I get solutions for them? So for example, like right now, what I'm interested is adherence. I know my patients, they know what to do, they know how to do, but very hard to follow the diet, especially, we had, for example, our year-end celebrations, Christmas, then now I'm already waiting for Chinese New Year. So what is it that can I do as a dietitian for Malaysian patients to help them stick to their diet? And the textbooks won't tell you that, because your textbooks are all American textbook, European textbooks. So how do I find those answers? That's where research comes in. So I do research. I ask the questions that textbooks cannot answer to find answers that are relevant to my practice, right? And when I teach, I need to continuously upgrade my knowledge, isn't it? I cannot always be teaching students backdated knowledge. So whenever I upgrade my knowledge, that new knowledge, I improve the patient care I do. The research knowledge that I get, I put it into my teaching. The clinical practice experience I get, I put it into my teaching. You get it what I mean?
Yeah.
So that all three roles, they reinforce each other. So at the end of the day, I benefit the patient at the clinic, I benefit my research participants, I benefit the students that I interact with.
As a researcher, your research is highly focused on diet and obesity. Do you mind elaborating more about how these research areas related to your role as an outpatient clinical dietitian?
Okay, so the research that I do focuses on, is in that area, obesity, so weight management, diabetes, right? But what I'm interested in is the food part and the eating part and the behavior part. So like I said, sometimes I have questions at the clinic that cannot be answered, then we do research. Like recently I was having a chat with the diabetes educator I work with, okay, a diabetes specialist, and we realized that, hey, patients find it difficult to follow a prescription. It could be medication, it could be diet, because perhaps they don't know how to manage stress. So then I asked her, I said, so how do we do this? And she said, actually don't know. So we're thinking, should we actually do a focus group discussion, like a small research, to find out, and then finally find the answers. So that's how the research actually reinforces my role as a clinical dietitian, as an outpatient dietitian. Does that make sense?
Yes.
Yeah. Then there are certain things like, for example, maybe because you also interact with other researchers, so you find things that are new, right? And when I look at my patients and I realize, hey, this is something that I can share with them, then it helps. Yeah. I've also the patients that I see in IB healthcare, some of them come from very high socioeconomic status background. So they're very educated, they have a lot of money. So they might ask a lot of questions that textbooks don't answer, websites don't answer. And because of what I do in teaching or research, I can always share with them the latest updates.
That's a very insightful view from you. And so back then you were a weight management dietitian at the Roche company for a few years. And then you changed to the Eli Lilly company as a dietitian or a program coordinator. Do you mind elaborating more about your experience while you were playing your role as a dietitian in these two companies?
When I graduated, like I said at the beginning of this podcast, right? I knew I didn't want to do food service, right? And so I knew that I might want to do either in clinical outpatient center or in the community, actually. But when I graduated back then, unlike now, most dietitians worked in hospitals, and that's it. If you are a dietitian, you either work in food service or you work in hospitals. There were very, very, very few community-based dietitians around. So I did the usual, I applied for positions in hospitals, and I came across this advertisement actually. This is my first job in Roche. It said it was looking for a dietitian to work on helping people with weight management in a non-profit organization. So it's like a community center, And when I asked my classmates at that time, they also didn't know what was happening. Nobody was working for community. I went for the interview and they told me that this is a non-profit organization that Roche helps to set up, and you're supposed to help people understand what's obesity, right? Expand the clinic, see patients, do media interviews, just teach people about obesity management and diet. So I thought, oh, that sounds very nice. Applied for the job and I got that. So that was exactly what I did as a weight management dietitian with Roche. Unfortunately, now that non-profit organization has closed down, but for 5 years, that's what I did. I would see patients at a clinic. We had a clinic, and the referrals came from other clinics, from the general practitioners. We would have workshops for patients with obesity. Once a week or once every fortnight, you come and then we do workshops for you. I would do a lot of TV interviews, radio interviews. I would write columns, magazines, giving dietary advice to people. So very community dietetics-based work, right?
Yeah.
And then also because the doctors had to do what we call continuous professional development, CPD points. It's like what you need to do when you graduate, right? So these pharma companies were always looking for speakers. And because I was already in a pharma company, so I'm a free speaker. So that's where I started in the speaking circuit. I would speak to doctors, pharmacists, nurses outside of the dietetic profession teach them about diet and obesity management. That was when I was in Roche. Then at that time I had my bachelor's degree, so it's something that you can come up with. But then again, when I saw my patients, I had questions. That the textbook didn't give solutions, right? So then at that time, I was working with a nutritionist in the center, and the nutritionist had a master's. So I remember sitting down with him and I said, hey, how do we do this? How do we find out? Then he says, you want to know all these skills, you do your master's lah. Only research will answer the questions you have. So that sparked my interest in doing my master's. So then I then went on to become a master's student. And then I got my master's in community nutrition. And my research was in the 6 months research was in the area of obesity and dietary intake. I was very interested in that. Then that was how I then moved on to Li Ling. Because when I did my master's back then, there was no such thing as part-time, no such thing as online learning. It's full-time, which means that I had to resign from my first job. Very scary, You resign from the first job. Then for my master's, I paid for it myself. And I was a student lah, but I was spending like somebody was working. So halfway through my master's, my bank account was very low. So I thought, hey, this can't go on. I need to find a job as well. But at that time, I was writing up my thesis. So then again, I saw this advertisement. It wasn't in the newspapers. I think it was in the MDA email. At that time, they had a newsletter. And they said this company, Li Ling, was looking for a dietitian specializing in weight management for patients with mental disorders, specifically schizophrenia. So I went for the job interview, found out what they did, and I thought this is what I would like to do, but I couldn't work 7 days a week because I still had my thesis. So I think for the first few months, they said it's okay, you work a 3-day week first, then after that, when you finish your thesis, you come on full time. So in Eli Lilly, it was a little bit different from Roche in that I was now working with people with obesity, okay, but now they have mental disorders. So schizophrenia, bipolar disease. And the difference is that also when I was with Roche, we had a center, isn't it, where patients came in, and then I might go out as well to do public outreach programs. But with Eli Lilly, there was no center. So I actually visited the mental institutions in Malaysia, all around the different states. We have different mental institutions. And some of the patients were hospitalized. Some of them were outpatient basis. But I drew up a program for them where they came, they met weekly, with all the other the similar like patients, right? And I taught them about diet, taught them about exercise, got them to lose a little bit of weight, and they graduated from their little programs. And actually, it was in Eli Lilly where I really realized or I recognized the importance of patient-centered care. That means whatever care we give as a dietitian or nutritionist has to be centered around the patient, because that is what makes them, for me, that is what makes the most impact.
How does these two dietitian role differ from your current role as an outpatient clinical dietitian?
The only difference is that now, let's just say when I see patients in IMU Healthcare, I don't go out anymore. I'll sit down there and then the patients come to me in my clinic or they come to me online, right? But I don't go out and do any more of this, what we call this public or community-based activities, yeah? The care that I give is the same. Yeah, you will still provide care using the nutrition care process. You still will have to assess your patient's needs. You still have to diagnose them. You still have to provide them the right intervention. You still need to follow up. You need to monitor and evaluate, to see whether what you're doing is right. Yeah. You still need to coordinate care. So there are certain patients you see, maybe you alone can't see them. You may need the help of a psychologist, or you need to coordinate back with the referring doctor, right? So that at the end of the day, it's patient-centered. It benefits the patient.
I have no doubt that everyone is curious about career pathways with a dietetic background. In this segment of podcast, we'll be exploring some of the possible pathways for the NND students. I'm sure that everyone would be interested to know more about the pathway to become a clinical dietitian and a lecturer. Dr. Li, would you mind sharing with us what you do on a daily basis as an outpatient clinical dietitian?
Okay, so the setting that I'm in now will be a little bit different from most outpatient dietitians, because when you graduate, if you're an outpatient dietitian, you work for a hospital, right? Yeah. As far as I understand from my colleagues lah, or from my vintage lah, my kind of vintage, that means my age, working in outpatient. If you're in a hospital, what happens is that you go into work every day. Say maybe you start at 8. Then if you have patients to see in the clinic, what we call outpatient, so you just go to your clinic and then you start to see your patients. Some clinic run from 8 to lunchtime break and then the afternoon clinic. Some dietitians would say maybe take the morning outpatient clinic and then in the afternoon they do their ward round, so that's inpatient care. Or in the morning is the inpatient care ward round, and then the afternoon is the outpatient care. Yeah, some dietitians who work in, say, screening centers, you have like some screening centers or specialist centers, like maybe cardiovascular central KL, so they could be just focused on outpatient, so they just see patients that come to the clinic. At IMU Healthcare, because I work for IMU Education, so I'm first and foremost a lecturer, but I also service IMU Healthcare, meaning once a week, I'm at clinics on Wednesdays. And because I like working with obesity and diabetes, so I chose the Wednesday clinic because the endocrinologist is there as well. The diabetes nurse specialist is also there. And it's very good because when the patient comes, it's sort of like a one-stop center. One shot lah, they see that the doctor, then they see the dietitian, then they see the diabetes nurse specialist. Or sometimes I will also have combined clinic with the diabetes nurse specialist. So the patient sits down, sees me, sees the nurse, and we see actually what's going on. If your glucose is not controlled, your sugar is not controlled, is it the food? Is it the way you inject insulin? Or is it your stress? So as the patient talks, both me and the diabetes nurse specialist will be assessing from our different specialties. And then whatever we get, we feed it back to the referring endo. And then the care then is tweaked, is refined to meet the patient's needs, values, and goals.
Basically, you work with the nurse and then you meet the patient and then discuss what's going on wrong and then you give a solution to them.
Yes, you have to work very tightly with the referring doctor, right? So at IMU Healthcare, I get referrals from 2 points, actually 3 points. One is by the endo, so there's definitely the endocrinologist, there's definitely for diabetes. The other is by the primary care physician that's there. So that could be diabetes, it could be obesity, it could be high cholesterol, it could be high blood pressure, it could be gout, right? And then once in a while, I get referrals from general practitioners outside. So because I do a lot of talks, so they do know I have a clinic here, and if they have no access to dietitians, they just refer their patient to see me at healthcare. So I need to communicate whatever care I'm giving back to the referring doctor as well. So that the doctor knows what's happening in terms of diet, and I know what's happening in terms of the medication and the overall care. So at the end of the day, the care then is refined and titrated back to what the patient will really benefit from.
What's the most special case that you come across from your point of view?
Special cases, I think you learn different cases. In fact, the more patients I see, the better I get, because I think sometimes my patients teaches me more than the textbook teaches. They come, they present their symptoms, we figure out what's happening. I learn a lot from them. But I think there were 2 incidences that has stuck to me, and it happened earlier on in my career, that as I think shaped the person I am today as a dietitian. So the first incident wasn't with a patient, it was me as a student in my final year placement. I was placed with a teaching hospital, and in that teaching hospital there was a professor. Now this professor wasn't in dietetics, the professor was in medicine, but the professor looked after patients and worked very closely with dietitians. And the professor also had patients who were admitted at the ICU, intensive care unit. So some of her patients were also unconscious. But what this professor did was, during her ward round, if she was at the ICU, she made it a point that she went to every single patient that was under care in the ICU, right? She would sit down, even though the patient's unconscious, she would talk to the patient. Depending on the situation, she may hold the patient's hands, she says, hello, good morning, I'm here, how are you today? I just check, and she updates the patient, about what's happening, where they're going, and she says, okay, I hope you get better soon. And she talks to the patient as if the patient is a person. And that was my first experience of patient-centered care. Because back then when I studied, patient-centered care wasn't a thing, We were more about evidence, more about this is what you do. And when I saw, I thought this is a very different way of interacting with the patient. And the patients also got better, right? It was a kinder way. So that was my first experience of patient-centered care. Then I graduated. And then my biggest lesson came as a fresh graduate. So as a fresh graduate, you make mistakes. This is what I want to share with you. Mistakes are okay. Sometimes the best lessons in life I learned from mistakes. I had this patient, I think I was only into my 3rd month of working, right? And suddenly this patient came with morbid obesity. BMI more than 45, I think close to 50. The patient was so huge that when he drove a 4-wheel drive, the steering wheel would sit on his abdomen. His arms would stick out of the car. Okay, so he comes in, and already the center itself, even though we call ourselves a weight management center, the center was not set up for huge people. So when the fella sat down on the chair, it was uncomfortable already, when you're big, you're heavy, and the chairs are not steady. And then I made my first mistake. Very fresh. I want to help. I really want to help, but I didn't see the patient as a person. So what did I do? I said, okay, first thing, obesity, measure BMI, measure weight, measure body fat percentage. But I didn't remember that the bioimpedance analysis machine that was there will not take his weight, right? There's only a certain maximum weight, isn't it? He was way above that weight. But it didn't struck me, He's looking at me, but I didn't realize he's that big. So I made him step on the machine, check his body fat. The machine said, error, error. I make him step off, and I make him step on it again. I think I made him do it 2 or 3 times. Then I said, I'm not sure what's happening. And already he was started to be feeling very embarrassed, right? But I didn't realize that. So I thought, okay, the next thing, better measure is blood pressure, because obesity, definitely there's a blood pressure problem, right? But the blood pressure machine we had, we didn't even have a large size cuff. It was just a regular size cuff. So the cuff is something that you put around the patient's arm when you measure their blood pressure. What did I do? I tried to force the cuff into the patient's arm, and the cuff got stuck at his wrist. I did it 2 or 3 times. Again, cannot take blood pressure. So in the end, the whole session ended after I did dietary intervention, and then the patient made a complaint. I would like to complain. The dietitian I saw is inexperienced. She's not good at what she does. Then I went back and reflected. Then I realized, you know what I did? I didn't see the patient as a person. That's why I overlooked the obvious that was in front of me, and that's where I started learning more about patient-centered care. And that's where I started reading about this technique called motivational interviewing, which I teach also. Later on, if you see me in semester 5, you'll learn a little bit about that. There are many ways to help behavior change. One is a motivational interviewing strategy. And that's where I started learning more, trying to improve myself.
Thank you for sharing your profound experience with us. It's definitely a new experience for me, and I'm positive that it's also an eye-opening experience for our audience. Like what you mentioned, you are facilitating patient-centered counseling as a part of your undergraduate teaching activities. Can we know more about your role and job scope of being a lecturer?
Okay, so if you are interested in becoming a lecturer, be ready for multifaceted role. If you are going to be lecturing in what we call clinical-based topics, where there's patient care, definitely you will try and have to maintain a clinical practice of some sorts. Because if you don't maintain clinical practice, then your skills go down the drain. How are you going to teach students, right? So that's that. You have to teach, set exam questions. Okay, teach, right? Teach and assess students. So that's the view that you see of me as a lecturer. And then you need to do research, because then research makes you a better lecturer, a better clinician. I already spoke 3 roles. And I think the 4th role that most students don't see as a lecturer is what we call academic management. Meaning I have to manage the course, I have to manage a program, get a timetable out. How do you make sure the students graduate on time? All that things, when you're calculating your grade point average, how do you calculate it properly? If you're transferring your credits from this university to another university, you have to organize all of that, or you've got to continuously look at the curriculum. Curriculum is what you're learning, right? How do you make it that you always reinvent the curriculum, revise the curriculum so that it's updated? it teaches the students the skills and the knowledge they need to be a dietitian, not for today, but for the next 5 or 10 years. So you're constantly thinking about that. So that's what a lecturer does on a day-to-day basis. So sometimes you see me in lectures. Sometimes if I'm not in lecture, I could either be collecting data for research, okay, or I could be on my laptop trying to plan my curriculum, or I could be in the clinic meeting my patients, or I could be at a conference or webinar teaching others. Because I teach students, I might as well teach other professions as well. I might also teach patients. So that's what I do as well.
That was very insightful. Dr. Lee, I'm certain that our audiences are most likely students from the N&D community. Hence, I would like to ask that what are some of the key characteristics that are required to become a clinical dietitian in your opinion?
If you want to do clinical dietetics, what sort of character must you have? I think you need to be first and foremost patient-centered. For me, everything must be patient-centered, right? Not okay. I'm not sure whether it's a character, but I suppose it's a value. Maybe that's a way of being. You need to be patient-centered. I think if you want to work in the outpatient setting, you need to be a good active listener, to really listen to what the patient is telling you, so that you can really assess their needs and give them what they need. And you also need to be a lifelong learner, because the care we give our patients today, while it's best today, in 10 years' time may not be the best. Research advances, care advances, dietetics advances. And so I need to keep up with my skill. I need to keep up with my knowledge so that I'm giving my patient the latest and the best care that they can get. And you can only get that through lifelong learning. Meaning after you graduate, right? You think like, oh yeah, no more EOS, no such thing, okay? So as you work, you still need to maybe go for courses, short courses, go for conferences, update your knowledge continuously, speak to others, so that you are always at the front of your game. Yeah.
Then how about being a lecturer or academia? What are the important characteristics and qualifications that are needed?
Throw in one added characteristic. You have to be very tenacious, Tenacious is like somebody who doesn't give up, no matter how hard it is. Because the academic pathway is quite hard. Yeah, you're doing many roles. Sometimes you're even opening doors that haven't been opened before, something very new. There's a lot of uncertainty sometimes, and you just have to work very hard and keep pushing until you get the results you want and not give up. So if you're in academia, you need to be tenacious. You need to be a lifelong learner, right? Very important. And also, then you need to be a very clear communicator. Because in academia, I communicate to students, I communicate to patients, I communicate to my research subjects, I communicate to the public, right? I communicate to other healthcare professionals. So if I cannot communicate clearly, then it's going to be a bit troublesome. That is the characteristics. Then you asked about the qualifications, right? Yeah. So in academia, you're teaching. You will actually be invited to lecture into a program. So you first find out what level is that program at. So if that program is at the level of, say, a bachelor's degree, then you need to have at least one degree higher. So master's or higher. So master's or PhD, yeah. And now universities are looking for PhD, because with PhD, then you can do more research as well. And you can have master students or research students, right? Like that. So you always need to have one qualification above what you're teaching.
I see. So for degree, it will be a master at least?
At least, yes. A PhD is best, yeah? Because in the PhD, what has happened was, I think people do not now know. I did my PhD when I was working with IMU, okay? And I realized that after I finished my PhD, I became a better research supervisor, because I went through so many years of research difficulty, right? And when you're a PhD student, anything that's wrong that can happen to the research will happen to you. I don't know why. They say, once you say, I'm a PhD student, all the funny things will come already. The challenges will come, and your supervisor will let you face the challenge yourself. It is a road that you have to take. And when you take it, you learn skills. And with the skills, then I now am a better supervisor. I know how to supervise my research better with my students. So that's why most universities want you to have at least have a PhD.
I believe that public speaking is one of the skills we develop as a dietitian or nutritionist, as we might get invited to speak on webinars and conferences at times. To our knowledge, you are also a speaker and host in these situations, such as the Makan Control or the live session with IMU Healthcare last year. Are there any tips or tricks from you to grab these opportunities?
To grab the opportunities, I think first, I think it would be you ask yourself, is this what I want to do? So not everybody likes, I would think this is public speaking, isn't it? Not everybody likes that. And if you don't, it's okay. There are many other ways to communicate what you know to others, through writing perhaps, through websites perhaps, if it's not public, to one-to-one to patients, and that is equally as good. In fact, sometimes can be quite powerful. But if you find that, hey, I enjoy public speaking, this is what I want to do, how do I make sure that, when you say grab opportunity, I would think that, how do I make sure that I get the invitations? I think the first thing to do is to focus on just being good at what you do, right? So once you're good at what you do, you're known for what you do, people will invite you to speak. Yeah. And then the second thing, of course, is to be a clear communicator, right? You need to be good oral communicator if you want to speak to the public. And then I think the third thing is you need to be able to give the participants what they need or what they want. So for example, like now this podcast, right, is targeted at students. Okay. So the first question I asked Li Ling, just now before we had this podcast, we had like a small chat. I asked her, I said, who will be listening to this podcast? What do the listeners want to get? So I realized, oh, it's students, especially IMU students, right? So then I will try and answer and give you my experiences that will help you, right? As a student, yeah. Or if I'm invited to say a webinar or conference for doctors, then I always ask, are these doctors general practitioners, or are they specialists, or are they medical assistants, right? Medical officers, right? So depending on who they are, I will then tweak what I have to give. Or if I'm going to a patient, let's just say there was one I had a Facebook live talk with there was is an influencer. I think you call them influencers, isn't it? Social influencers. So I asked, what sort of patients come to your live Facebook session? What do they need, right? And then we will give them that. So we talk more about practical skills. That's why the most exciting part for me in any webinars or I don't know, these talks is the Q&A. I always look forward to the question and answer session. I know a lot of you are scared, right? Because in question and answer, you don't know what sort of questions come. What if you answer wrongly? But for me, the question and answer session is the most exciting, because this is when I get to hear actually what is it that they want to know. And if I have the information, I can then pass it on to them and I can be of help.
So the Q&A session also help you to know what are the needs of the community also.
That's right. That's right. And I would like to just share something that might be very useful for students, right? Anybody who wants to do public speaking, will you feel frightened? Yes. Sometimes when you step up and then you know there are many people listening, you get a little bit of that butterflies in the stomach. Because what if I say the wrong thing? Then I'll embarrass myself. Then my boss scold me for being an embarrassment. And then worse, if I say the wrong thing, then 500 people listen and then go and do the wrong thing, right? So those will give you the nerves. And one of the senior managers in one of the pharma companies that I worked for taught me something very useful. He said, if you're anxious, just ask yourself, list down the 5 reasons. So for you just list down 3 reasons why you're going to enjoy yourself. So for me, like, why am I going to enjoy myself doing this podcast? Because I always enjoy interacting with students. They always give me a new perspective. Now I'm also interested in doing something that I think I've told to do later on, to promote my Instagram page, and I'm going to enjoy myself. So once you start to enjoy yourself, you become less anxious, and then you flow better.
You learn a lot from every question.
Yeah.
It's a piece of very astonishing advice from you, and I have faith that it will be useful for us in the future after we graduate too. So here comes to the end of this episode. Dr. Li, before we end our session, is there any advice that you would like to give to students who want to become a lecturer or a clinical dietitian one day?
Advisor, I think our goals will change. Sometimes they do change. For some people, it's quite straightforward. So what they want to be as a in your early 20s is what they want to be when you're 40s, is what they want to be 60s. So if if you're that type of character, that's fine. But most cases I meet people, I realize that who you want to be or what you want to achieve changes as your lifespan goes on. So I think right now as a student, enjoy your student life first. Okay, be in the moment, enjoy it, experience it to the fullest to understand better what is it that you want. You may think at first year, I want to be a clinical dietitian. Maybe by the third year or the fourth year, you decided differently, and that's okay, right? So experience that to really figure out what you want, and then after that, just go for that job that you want, right? But even if you don't get the job that you want, go for the job that you got with an open mind, because you can always learn new things and you can always expand your career in any place that you go. If you're clear with, I think you need to be clear with what is your role in society. Bigger than whether I want to be clinical dietitian or bigger than I want to become a lecturer, right? As a person, what is it that you want to do most for the society? What do you see yourself doing? And then you can expand from there. And then you'll find that wherever you are placed, you will be able to flourish.
To find your position in a social or an organization, and then to have a growth mindset.
Growth mindset, that's right. You got that correct. So always expand yourself. Different situations may call for you to reinvent yourself, and that's not wrong. You see all the brands, if every day the same brand sell the same dress or the same shoe, customer market will decline, isn't it? So yeah, growth mindset is very.
Thank you so much, Totally, for joining us today. It was an interactive session with you, and we sure do hope to stay connected with you. Would you like to share your social media account with us?
So you can find me on Instagram at li.ching.li.
That's the end for our session. Thank you, Doctor.